The primary aim of this study was to determine the prevalence of HBV genotypes and their associated biomarkers among patients with chronic hepatitis B infection attending the Moi Teaching and Referral Hospital Liver Clinic. This aim was developed in response to the growing recognition that HBV genotypes play a critical role in influencing the natural history of infection, viral replication, and clinical outcomes. Although Kenya is classified as a high-burden country for hepatitis B, there has been limited locally generated data describing the distribution of HBV genotypes, particularly among patients receiving routine clinical care. Specifically, the study sought to identify which HBV genotypes are circulating among chronic hepatitis B patients attending the MTRH liver clinic. Understanding genotype prevalence in this population is important because different genotypes have been associated with variations in disease severity, likelihood of progression to liver cirrhosis or hepatocellular carcinoma, and response to antiviral therapy. In addition to genotyping, the study also aimed to examine key virological and serological biomarkers associated with chronic HBV infection. These biomarkers included HBV DNA viral load and hepatitis B E antigen, or HBeAg, which are routinely used in clinical practice to assess viral replication activity and disease phase. By evaluating these biomarkers alongside HBV genotypes, the study aimed to provide a more comprehensive characterization of chronic HBV infection in this clinical setting. Another important aspect of the study aim was to generate context-specific evidence that could inform patient management at MTRH and similar healthcare facilities in the region. By documenting genotype prevalence and biomarker patterns among patients already enrolled in care, the findings have potential implications for treatment monitoring, risk stratification, and long-term follow-up of individuals living with chronic HBV. In summary, the study aimed to determine the prevalence of HBV genotypes and to characterize their associated biomarkers among chronic HBV patients attending the Moi Teaching and Referral Hospital Liver Clinic. This objective addresses an important knowledge gap and contributes valuable local data to support improved clinical decision-making and HBV control efforts in Western Kenya.